So I went to my doctor. I'd had knee pain for 7 weeks, and I thought it would go away. It didn't go away. So when I went to see my doctor, he confirmed. He did an ultrasound. He told me it appeared that I had a torn meniscus, and he could tell that because there was a Baker cyst in the back of my knee, which is a drainage result of a torn meniscus. So he referred me to a doctor, and I went to see that doctor, and I wasn't really I felt kind of rushed, and the part that kind of disturbed me most of all was he. It was a short interview. He didn't touch my knee. He didn't look at my knee. All he said was, based on the MRI, you have a huge tear. No injections are ever going to save that tear. And he said, what we need to do is check with your insurance, see if they'll cover this. And I said, okay. So I left. I walked out the door and I'm spinning and I'm thinking, what just happened? I didn't ask him a single question. I didn't ask him, what does a torn meniscus mean? What does a torn meniscus look like? I didn't ask him. So I started researching it. When I researched it, what I discovered was that older people with torn meniscuses, 10 years after, end up requiring knee surgery because they end up with bone on bone. And then I started looking and I started researching, and then I found Dr. Stone. And I found him on a TED Talk, and then I found his website, and then I came in to see him. His approach was professional, clean. I felt welcome when I walked through the door. I didn't feel like I was in a harried environment. He examined me, confirmed that I had a torn meniscus, and then we scheduled it. We scheduled it for July the 30th. I came in, had the surgery done. In my mind, the surgery is not a complex thing. It's arthroscopic surgery. The doctor goes in, cleans it out, and then they're done. And in this particular case, what I found out was after the surgery, it was the care that I received. It made an incredible difference. It was, I got 2 hours of physical therapy every day for 10 days, and then I was put on a regimen. I went back home. I do not live here. I went to see a physical therapist at home. When I went to see the physical therapist at home, I got 30 minutes. They did my physical therapy in 30 minutes, threw me on ice, and kicked me out the door. And compared to this, when I come here, I know the 6 young ladies that work at the front desk. I go in for physical therapy. I warm up on a bike. I'm loosened up by massage. And then I do exercises, and it's usually an hour and 45 minutes to 2 hours before I leave. And then I've taken that discipline, so now 5 out of 7 days I've been getting to the gym. I feel healthier, I feel stronger. There's core exercises that Shannon had given me that I'm doing that have made me feel stronger and feel better. And at the end of the day, what I was thinking was that the surgery was, I said something to Dr. Stone when I came out of the surgery. I said, Doc, we had a smooth landing, and I didn't have pain for 8 days. I mean, it was so awesome. And I said, we had a smooth landing. And then afterwards, the care that I got, I really appreciated it. And I had something to compare it to, because when I got home, that's not the care that I got. Yeah. Seeing either the doctor at home or the physical therapist at home.